The eyes are the windows of the soul, and how true that is. I mean, when we relate to people, we look at their eyes. We look at them to see if they're happy, if they're sad, if there's something going on that, that we don't know about, if they're quizzical, if they're funny, if they're doing anything in their life that's important. We make eye contact with people. Well, when you get older, sometimes it masks that feeling of joy that you have by looking in somebody's eyes. You wake up and you see the hound dog look with the skin hanging down laterally, or you get the bags underneath your eyes. Sometimes those bags are so big you can carry your lunch in them. What do you do then? What do you say and what do you do? And that's what people come into me and say, hey, doc, I look older. People look at me and say, are you tired? And this is what we hear when people want their eyelids done, or what we call a blepharoplasty. And let's talk somewhat about eyelid surgery or blepharoplasty surgery. Now, in crow's feet, if people just have crow's feet, we tell them, listen, all you really need to do is perhaps inject some Botox. It'll help those lines go away. Or if you have little fine lines and no bags, we can just laser those, what we call a laser, a CO2 laser, just to take away those little fine lines. But when the skin is drooping, when the fat is poking out and it makes you look tired, a blepharoplasty is in order. Let's talk about the intricacies of how we do blepharoplasty surgery. Well, the first thing we do is evaluate a patient. We look at the patient and explain to them exactly what they can expect with this. Once again, this is a surgery that we'll do with a patient not asleep but under a sedation, where they'll know they're in the OR but not care, not wake up and know where they've been and really not have any recollection of what happened to them. We measure the fold on the upper eyelid for upper eyelid skin, and we see the first line, which is called the superior tarsal fold. And then we measure the exact amount of skin that we need to take off. Most women come in and say, doc, I can't put my makeup on anymore. I can't do it because it messes up every time I let my eyelid down. It messes up my eyelid skin. What we need to do is measure that skin, excise that skin off, and then there are two fat pads on the upper lid, the medial and the lateral compartment of fat pads. That's what gives you that heaviness, that overwhelming bagginess to your eyes. We remove those bags and take those fat skin away. We redrape it and reshape it and take away the loose skin and literally lift the skin up to give you a more wide-awake look. On the lower lid, we actually hug the lash line, what we call a subciliary incision. And then we flip the skin down, exposing 3 fat pads there. The bulges that you see underneath your eyes, the dark circles, are usually a remnant of those fat pads coming through and laying too close to the skin. And what the light does then is bounces off those fat pads and gives you a shadowing, a heaviness to your eyes. So what you have to do is take those fat pads out. Take out what we call that herniated fat pad. We've all heard of a hernia. A hernia is when you get a tear in a muscle and something pokes through. Well, the same thing happens to your eyes. You get a little herniation, what we call the orbital septum, and the fat pad pokes through and it lays too close to the skin and gives you that heaviness. We have to take that fat pad out. We have to redrape it, reshape it so that your eye looks smooth again, that you don't have the bump underneath there. Eyelid surgery is painless surgery. You come in the morning and you go home that night. You can put some ice packs on it, and we tell the patient, don't do any lifting, any exercising. Just take it easy for a few days after surgery. The skin there is the thinnest on the body. The sutures literally can come out in 4 to 5 days because it's such thin skin. Now, if you have different problems with your eyes, there are other ways to correct this in addition to blepharoplasty surgery. We talked somewhat about Botox, where you can take away the little fine lines and laser resurfacing. But when patients get older and they get a hollowing to their eyes, we can actually fill in that hollow, that skeleton look, with fillers like Restylane or Perlane that allow us to give a nice smooth line to what we call the nasal jugal groove, or underneath the area of the eye. Eyelid surgery is one of the most corrective surgeries we see. In fact, in men, it's probably the most prominent surgery that we see men coming in for cosmetically. And they do that because they're competing in the workforce against younger guys, and they look older. They go in and make calls to patients or to clients, and they look at them and say, you know what, you look tired, do something about that. And it really rejuvenates them. The eyes are the mirrors to the soul. They express what your feelings are. Why not look in the mirror and like what you see? Why not clean off that glass, make it look better, and do blepharoplasty surgery?